what I feel, this is completely my opinion. I'm not against any other ways of practice. I myself have been in academics previously, so I thoroughly enjoy that, and I would still like to join academics as well as continue with my private practice. So one of the important reasons why private practice is necessary is it is the best way to thoroughly work on your areas of interest. So eventually, as you know, interns or as MPTs, we have come to a point where we know that what in physiotherapy you or I like to do. Like I am keenly interested in pediatrics, and that's what is my area of work mainly. So my private practice thoroughly gives me these opportunities to work with pediatrics. Also, it provides with immense opportunities to explore and enhance on our hands-on skills, because no, you are actually with the patients throughout the clinical time that you are dedicating, as unlike other professions or other paths of career where probably you are not completely with the patients. So it is a learning process. We keep on enhancing our hands-on skills. Also, it has multiple ways to grow your business or your work. It is a very good way of having a good revenue, of course. But apart from that, what is important is it gives you a best way to enhance or to promote yourself as a professional, for your own growth as a physiotherapist. So how do we plan the physiotherapy practice? So let's look at the points that how we can plan the physiotherapy center. So first of all, to start with, we need to research the market, find the location where we want to do it, look at your initial investment, choose your niche. We have to research the legal liabilities. We have to develop a marketing plan, design the space, look for necessary physical therapy equipments, and plan about building your network or making contacts. All these things, it starts simultaneously the moment you start thinking of having a private physiotherapy practice, because each and every point mentioned here is very important to run your clinic or to have a good patient inflow in your clinic or in your department. So speaking about researching the market, what I mean by researching is the market is look into which area you want to start your clinic or your department, and what type of patient flow is there. Does it match with your area of interest? Okay, or in which area or of the society or which area of the city there is lack of physiotherapy centers, and try to open your center in that area where you know that there is no other competition or no other physiotherapy center right now. So you can give best of your performance here, because you will have a lot of people, a lot of clientele eventually coming to you. So then, speaking about the initial investment, which is very important, which has to be given a thought, that how much can I invest right now to begin my clinic. So a person can start with a very minimum size of 1500 square feet area, which is like one small room. Okay, or you can have a big, 4 rooms, completely, state of the art infrastructure, and start a physiotherapy clinic or department, depending upon how much a person can invest in the beginning. Okay, so minimum 1500 I have mentioned here is because the area would have at least one consultation table and one assessment and therapy table at least, and a little bit of floor area where you can take gait training or standing exercises. So when we are planning the floor, or making the initial investment, you have to also think about whether you want to purchase the space or you're going to go for rental area. Okay, so if you're going to go for a rental area, then of course negotiating the lease, making the agreement, there are a lot of legal procedures for which you will have to have a legal advisor who will tell you the legal liabilities and laws for that. And if you want to go to purchase the space, then think about how much in hand finances you have, how much you can pay right now, and how much loan you can pick up, from which bank you can pick up, how much EMI it will be per month, and whether your income in that area is going to be sufficient enough for you to help to pay the EMI that will come. Okay, so a person will have to look for different loan options. uh, to give a brief idea, now this is a very arbitrary number here, because as I said, that it depends upon how big or small you want to start your setup with. But the physiotherapy equipments, if the basic ones, which involves the stimulator, the TENS machine, IFT, and probably a traction table, the basic ones and basic exercise therapy equipments, so that investment goes up to 1 to 1.5 lakhs minimum. Which, but this number has no end, because you can go for combo machines, you can go for advanced, you can go for Pilates equipments, anything and everything, right from having an aquatic therapy setup as well, which will be much way expensive and much of an investment compared to what I have mentioned here. This is very basic. Okay, this is just to give a brief idea about how much at least you will have to invest. Apart from that, you will require an initial investment in designing a website or social media handling consultant. Now, this in today's world is very, very important, and one of the main way of gaining patients and spreading your word. So there are a lot of setups, or a lot of engineers, software engineers, who are working specially in developing websites for clinical practitioners, for doctors, and they handle your social media as well, like the Facebook, your Facebook page, Instagram page. Okay, of course we have to pay them and they will handle it for you. And whatever fees are, you have to pay to the consultation of legal advisors. Apart from that, if you need require a receptionist, or a maid or somebody to keep or to manage your to keep the clinic clean or to maintain the hygiene, so that will be different investment. So take a paper and pen if you want to start with your clinic, and write down how much initially you can invest, and then go ahead with finding the area. When you are finding a location, consider the following points: that whether there is availability of lift or ramp, which is of course a very big necessity for any kind of patient who is going to come to physiotherapy especially. So lift or ramp is essential. Availability of parking, yes, this has become a very important criteria now, because people, when they give a call to my clinic, they ask on the phone itself to my receptionist, do you have an no do you have facility of parking there, because my child is quadriplegic and I'm going to come in the car. So yes, my receptionist has to answer saying that yes, we do have facilities for parking, we do have facility for lift, ramp, everything, so you can come with the wheelchair, everything is available, and we have an assistant who can help you to carry the child to the department. Of course, we have to look for enough ventilation, water, and electricity supply. Electricity supply I have mentioned here specifically because if we have to work on electrotherapy modalities, so electricity supply, either a generator backup or inverter has to be there. So think about that as well when you're planning your center. And presence of any other clinics in and around the same locality. Now here with any other clinics, I do not mean any other physiotherapy clinic. Any other clinics, by that it can be any other orthopedic clinics, any other polyclinics, any other person with a any other cardiac consultant, or a gynecology and obstetric consultant, anybody who can probably refer you patients to the clinic, to your department. Okay, pediatrician. So that is a very big help for you to gain a lot of patients, because the consultant there is going to directly refer the patients to your clinic. You have to choose your niche. Now by niche, what I mean is you have to it refers to a position or interest that allows someone or something to thrive in a particular environment. Like in my case, I am particularly working keenly in pediatrics, but my setup is orthopedics and pediatrics, as I have an orthopedic consultant working with me. So I do get a lot of orthopedic patients. So I have a setup of orthopedics as well. But since I'm specialized in pediatrics, so I have made sure that I have one room which is designed for pediatric and neurology rehabilitation. So that's my niche. Okay, so when you are going to start, you have to think that how much dedicated work you want to do in your own particular area of interest, and whether you will be getting only those patients or patients with all other issues as well, and design your clinic and arrange for the equipments accordingly. So choose your field of interest, that something that you know that you are best at. Okay, and plan the department or your space, whatever available space or floor is there, according to your area of interest. So distribute the position of your no examination tables or the mats or the floor exercises or parallel bars if you want to put for neurology, or if it is going to be A and C, like antenatal, postnatal, that you are interested in, then arrange the place in such a way that it will be beneficial for the patients that you're going to get. Now, coming to the laws, we have to research about the laws for private practice. So for this, I have thoroughly researched during opening my own clinic, as well as since it's been almost 4 years now, I'm running my clinic. I thought of researching about this again. I spoke to a lot of people who are working in private physiotherapy, who are working privately. So what I have come up with, there are only two very important things that we have to consider. One is Clinical Establishment Act Standards for Physiotherapy Center. This was enacted by central government in 2010 to provide for registration and regulation of all clinical establishments. So now by all clinical establishments, actually this was designed for anybody, any doctor who is going to have private practice, wherein they have one page or one annexure for physiotherapy practice. So this act is applicable to all kinds of clinical establishments from public to private sectors, including single doctor clinics as well. So if a physiotherapist wants to start her or his own private clinic and work only singly, like not with any other consultant, so still this act has to be followed. Now what this gives is, it is just one big list of instructions where they have mentioned that what are the standards that you have to maintain while you're going to open the clinic, like what are the types of equipments that are required, how much should be the space, and know how much should be the criteria for getting patients, what should be the fee structure, comparatively this they have mentioned in the act. And the second thing is Shop Act or Gumasta Act. Shop Act, this is a common name taken in Pune if you want to start working in Pune. Gumasta Act is something which is, it is the same, but it is called Gumasta mainly in Mumbai or in BMC area. So wherever, these are the two major areas I have considered. Okay. Apart from that, all over India, Shop Act is necessary. So apart from Pune, Mumbai, wherever you're going to start your clinic, you have to consider about Shop Act. So this basically means that it is a type of legal permission that we have to seek. It allows a businessman or establishments to do business in a particular place. So if you're going to start your business in some XYZ particular place, so this Shop Act registration is necessary. Okay. I have not mentioned one thing here is biomedical hazard waste management, because we as physios, we don't generate a lot of biomedical hazardous stuff except for gloves probably that we use. But if anybody is doing dry needling or practicing dry needling, so the needle that has to be discarded. So if anybody is going to do that practice in the clinic, so they have to register themselves with the biomedical waste management, wherein they come to your clinic maybe once a week or twice a week and pick up the biomedical waste that is generated in your setup to discard it. Okay, so that also has to be taken into consideration, which I have not mentioned here because we as physios directly don't do dry needling. It's completely a different aspect. Okay. Then going ahead, designing the space. So we designing the space, of course it is a common sense that if we have taken any space, so keep some finances ready to pay the fees of the architect and interior designer, because they are the best people who are going to help you design the space as per your requirements in best of possible ways. So make sure that the space is utilized properly for treatment modalities, expecting the amount of patient flow. Like if it is going to be only one therapist, one examination table, then maybe that's the patient flow is not going to be that much. Maybe it will be only by appointment, one patient at a time, one therapist, one patient. But if it is a comparatively bigger setup, like probably like the way I have 4 tables, one low bed, and as well as a pediatric setup. So my patient flow is comparatively more. Like I get sometimes 5 or 6 patients at the same time, which I have to see. So we have compartments. We have designed it in such a way that I can see 4 adults, 2 pediatrics probably, and one floor exercises or someone doing standing exercises in one of the spare room that I have. So depending upon how much patient flow you're expecting, design it accordingly. Divide the space in following categories. Again, everybody must have visited a lot of other clinics But when we are planning our own clinic, we have to make sure that we are considering all these points, like reception or waiting area. Even if it is a very small setup, as I said, only one table, consultation table, and one examination table, still try to have some waiting area, maybe near the entrance, where you can put at least two chairs, because it is essential. Sometimes it's raining, sometimes the weather is not good, there can be multiple practical issues that you would face, and it is not good or advisable to make the patient stand outside your clinic till you're done with the previous one. So yes, reception and waiting area is necessary. Consultation room, if possible, try to arrange for a room, because then the privacy of whatever discussion you're having with the patient is maintained, as against if it is directly open and you're seeing one patient and consulting another one, then the privacy is not maintained, which is not a good thing. Okay, then physiotherapy treatment area, a dedicated physiotherapy treatment area, of course, if you can design. Toilet or washroom, yes, very essential, especially if you're going to have no antenatal, postnatal, setup, or it is a pediatric setup. And pantry, which is of course completely optional. If it is there, good and good, or if it is not there, that is also fine. If you have space, always go for it, because it helps you keep no water dispenser, your it can help you have a refrigerator where you can keep the ice packs, ice lollipops, or anything that you require for rehabilitation purpose. Then going ahead, so this is just an example, a brief, just to give an overview. These are Google images, just to give an overview. So this is how you can have a, so this is the waiting room, this is the reception, these are the examination rooms. Here you are completely maintaining the privacy for the patients because they are closed, well closed. And this is the exercise therapy room. You can keep equipments, you can have floor exercises, you can have group exercises here, as there are no curtains or no privacy maintained over the here. So you can divide your therapy room accordingly this way. Then in the second image here, you can see this is a very busy department, whereas in the third, this is a very quiet department, whereas I told there is one consultation table and one therapist seeing one patient at a time. Or a busy department where probably two or three therapists, they start working together and they're seeing the patients simultaneously. So the multiple things are happening in a busy physiotherapy department. So this is just an overview. This is just to make help. This is just to make you help to think, how do you want to plan your setup? How do you visualize your own physiotherapy department? Okay, so just to give an over, no, just to give a insight. So this is a reception area. Probably this is a consultation table, which has a properly ventilated, and we have a quiet room where I can consult the patients. This is a physiotherapy, exercise, and electrotherapy department, one low bed, and then three traction table and two examination or exercise tables, and my own dedicated physiotherapy, pediatric therapy room, which is specially designed to keep the pediatric equipments. I have a platform swing, I have bolster swing, I have ladder, I have another things which needs to be hanged. So while I was designing while the civil work for my clinic was going on, it was specifically mentioned that I want the civil work to be done in such a way that I would require hooks to hang my equipments. So again, this is just to give you, to start with the thought process, that when you want to have such specific requirements, make sure you mention it while you are designing your office or your own department. Okay, going to the next, we have to fill out all the necessary paperwork. So finalize a business name. Okay, a business name is very essential, because as I said, that today's world is a completely social media world. You need to have a very nice catchy name, which is going to get hampered on public's mind. Should be such a way, you want people to Google the name, you want to check out the Instagram page of your clinic, you want to check out the Facebook page, what is happening. So have a good business name, maybe design a logo for yourself, for you can get the logo registered as well, so that nobody copies your logo, or nobody can copy your clinic name. So that is also one big procedure, you can get it done. And of course, have an up-to-date therapist license. So since we are in Maharashtra, so OTPT Maharashtra OTPT Council therapist license has to be up to date, which is for 5 years. So after every 5 years, we need to renew it. So make sure that it is properly renewed every 5 years. Okay, develop a marketing plan. Now, when you're planning, the day you start thinking of having your own clinic, you have to think that how do I get patients to my clinic? Okay, so you have to have a marketing plan. So design your letterheads, because you would be documenting it. You would be, referring patients to the other personnel. You would be uh, referring patients to hospitals or anything. So you need letterheads, you need business cards. These are very essential, because your the clinic name, the contact number gets circulated if you have business cards. And yes, start building a website for yourself. It is very essential in today's date that you have a website, because no 90% of your clientele is going to check out your Google page or your website and your reviews for the clinic, how much work you have done, what is your experience, what is your knowledge, from where you are passed out, everything on your website before they approach you. And if they are convinced enough with the reviews and with the website, then and only they are going to come to you. Especially the IT sector, I tell you, they are the ones who are keen about all these things, and they have no like read about multiple reviews about multiple doctors, and then have filtered and shortlisted you and come to you. So it is very essential that we build a website and have a good Google page for your clinic. Then start building your network. As I said, word of mouth, yes, it still remains the strong criteria. You do best of your work, give good treatment. No, those patients or those people are going to go and speak about you in the society, in an area, in and around their area, to their relatives and everybody. And yes, so they are the ones who are going to get you a maximum clientele. But they will tell about your name, about your clinic, but to come to you or not to come to you will be decided by the social media pages that you are going to put on your put on the internet. So anybody, as I told you, is going to check your website, they're going to check the Instagram page, they are going to check your reviews. How much reviews do you have, how frequently do you get the reviews, how many are the genuine reviews? Okay, I get a lot of patients who tell while consultation that no, I read a lot of reviews about you, and so then we thought that we would come to you. I read a review especially about back pain you have treated, and my mother has back pain. So I have come to you because that XYZ person's review mentioned that you have very well treated very well treated the back pain. Okay, this Google My Business is something very essential. So have your clinics or departments page set up on Google. Put the pictures about your clinic, put the work that you do about the maybe patient testimonials, maybe short reels or short videos, or what new you have done, maybe you have certified yourself in something new. Then put it, whatever good you do, whatever you do genuinely, just put and publish it on internet. That is what is going to get you a lot of patients. Apart from that, the promotional seminars or webinars, whatever, for considering the pandemics, promotional seminars. So whichever area you start your clinic, you have to, as I told you, we are going to research about it initially. So if you have once you start researching, you would come to know that how much is the awareness about physiotherapy in this area. A lot of people still today in 22 also think that physiotherapy is only orthopedics, only after accident, only after fracture. But no, so you know what is physiotherapy, so go out, maybe not do some promotional seminars, arrange seminars. If your niche is about like antenatal postnatal classes, so speak about it, speak about why it is important. Okay, or so then catch up the days, like if now March will be Women's Day, so if you're planning, so pick up that Women's Day and start planning it right now, that what I'm going to do for my clinic on Women's Day, so that I know I am promoting my clinic's name as well as creating some awareness in the community. This is just an example. So we have World Cerebral Palsy Day, World Stroke Day, World Cardiac Day, whatever, World Arthritis Day. A multiple of days are available. World Physiotherapy Day. So start the planning right now, that throughout the year, which days I'm going to pick up or which events I'm going to do. Okay. Then maybe World Physiotherapy Day, you can arrange for a medical camp, a free checkup camp. In that also multiple things can be done, like it can be an orthopedic camp, so tie up with an orthopedician. It can be a pediatric camp, so pediatric fitness you can do, like assess pediatric fitness considering the pandemic, that kids are at home, how fit they are, so pediatric fitness. You can tie up with a pediatric dentist if you have a dentist clinic in and around your area. So both of you all can do it together. So you get more patients. So they get the dental checkup done and fitness checkup done. That's it. What you do, you can give them just takeaways, like get a printout about what how pediatric fitness is necessary, what exercises kids can do at home, in their homes, so to remain fit, to combat the childhood obesity that is booming right now. So just to give you an overview, or as I told you, you can have for arthritis if it is, then no, arrange for a knee camp and get a brochure with knee exercises and just distribute that. This is a little bit of investment and a lot of no, hard work from a therapist side, but yes, it will give you benefits. It will give you fruits later on. Maybe if not immediately, after 2 3 months, after 1 year, after 2 years also, I have got patients or I've got people who come and tell me that yes ma'am, I had met you during that seminar you had conducted there, and since then I wanted to speak to you. My mother-in-law was out of no was staying, wo gaon mein rehte the, she has come now and I've got her here for to meet you and to teach exercises. Please make sure that her back pain is gone. So don't think how this is going to be immediately beneficial. It has got long term effects. So just keep doing something. It will give you fruits eventually. And patient testimonials, you can have written testimonials, you can have video testimonials. These are very essential. So this is how you start building your network. Apart from that, to get your patients, you have to go and meet, maybe you can know, once you're starting new, you can go and meet people or consultants around the clinical setup area. So go and meet orthopedic consultants, cardiac consultants. You can meet general physicians. Explain them that what all therapy no modalities you have, what all facilities you have in your center, how you're going to help to treat the patients. Like a lot of since it's winter, a lot of Bell's palsy, facial palsy cases keep coming up. No, if it is not if it is not a well highly educated area, if it is an area where you have mixed crowd, like in my area I have people who are coming from low socioeconomic status to high socioeconomic status. So in mixed area, a lot of people keep going to general practitioners. They don't immediately go to neurologist for Bell's palsy as well. So but a lot of general practitioners, they don't know that physiotherapy is essential for Bell's palsy. So go meet, tell them that this is the season where you get these kind of patients maximally and we can help them. Okay, tell them about cardiac rehabilitation. They'll tell them about respiratory rehabilitation, how you can help them. So tell them that send patients with cardiac issues to us. We will treat them. Okay, so spread your word, meet a lot of other consultants and start building your rapport with them. Distribute your letterheads, distribute your business cards to other consultant doctors. Executing with your private physiotherapy practice. So now till now we were just planning that I'm going to start. Then one fine day you do the opening probably and you start from the next day working. Now you're sitting in the department. How are you going to get the patients? That's the major question. So, no, whatever I have explained previously, the stronger your network, the better will be the patient flow in your practice. So, in the beginning, you will not have any reviews. You will just make the website, probably write blogs about it, write about the work that you have done previously. Maybe no, you can ask where you were working previously, ask that physiotherapist or that consultant to give you give speak about you or give something written about the write up about what good work you have done in their setup. So that is all. But what about the patients? How are they going to come? So here is the role of other consultants who are going to refer the patients to you, and the camps or the seminars that you're going to go promote, you're going to do. Okay, and genuine dedicated work towards patient treatment, that is the key for a good improvement or a good patient flow. Okay, sab kuch kar liya, reviews, you have made the reviews, you have done the Instagram page, everything, but genuine work, actually giving good results is what is going to give you a lot of patients, because word of mouth still remains one of the strong factor. Okay, always trust that, don't only go with internet. Okay, now another major aspect when you start with your clinic, how much should be the fees? Okay. Now, as I told you, the fee structure, it is highly variable in our community. As physiotherapists, there is absolutely nothing common in fees. Right from home visit fees two consultation fees, two therapy fees for pediatrics, for neuro, for ortho. Nothing is no uniform. What fee structure I have in my area, I have built it according to the patient flow, the community, that no affordability of the patient. So because I get a lot of patients from low socioeconomic status as well, they come to the orthopedic consultant and then they are referred to me. Okay, so affordability of the patient is one major criteria when you're going to decide how much should be the fees. In which area, in which no geographical area is your clinic? Like if your clinic is in Koregaon Park or something, no, or say Baner, Aund area, which are no there the IT sector is booming and they do pay. You know, the mentality of the people is they will pay for the therapy because they understand the importance. But in another areas we still are here, you know, we still need to convince the patient to come for physiotherapy regularly. We still need to tell them how important it is, why they need to do. Okay, so affordability is necessary. Your hands-on experience and your expertise, how expert or how experienced are you as a therapist to demand that much fee. Okay, so maybe start with some basic fee structure, work for a year or two, and then when you know that now I am better at what I was doing, you can hike your fees, raise the fees, but start with something nominal in the beginning. Then how many joints are being treated, so then make your packages according to that. So if you're treating only shoulder, then one fee structure. If you're treating elbow, shoulder, or it is back, knee, so depending upon that you can design or you can decide your fee structure. How much is the use of modality? Now till today we do get a lot of patients who directly come for physiotherapy, but yes, we do get a lot of patients who are referred, and in the referral, no, it is written that back pain, kindly give IFT and traction. So if this is mentioned, I need to respect to that no referring orthopedician. And yes, and of course do what the referring orthopedician has mentioned. Along with that, it is my duty to explain the patient, to educate the patient that apart from this, exercise therapy is also necessary, and we would do advise you to do exercises as well. But it is completely a different no mentality of patients. Sometimes they do agree, sometimes they don't. they are very particular about जो लिखा है उतना ही करना है. ठीक है, so how many treatment modalities are you using? According to that you have to decide your fee structure. And how long will the treatment continue? Like if it is neurological cases, pediatric cases, pediatric cases sometimes they keep coming for years together, alternate days, twice a week, something like that, or every day for 6 months or for 3 months, initial 3 months they come every day. So then once, since a patient is going to pay you every day, you cannot just keep your fees extremely high, because then you're going to lose your patients, because patients will not be able to pay. No, they won't be able to afford it. So think about that as well, that how long the treatment is going to continue. Okay, offer different payment options as well. So cash, UPI, QR code, this is necessary. So no, Google Pay, phone pay, all these facilities has to be available in your clinic. Ensure availability of payment receipt for the purpose of insurance claim. A lot of insurance policies do include physiotherapy reimbursement. So have a billing book, a proper billing book with the receipt number and everything with your stamp, so that you can give that to the patient for them their reimbursement. Design different treatment packages, like packages for 10 sessions, packages for 15 sessions, packages for 30 sessions. So you can always explain it that no, for one session it is this XYZ amount, but when you're going to come for 10 sessions, like for say it is a case of shoulder, frozen shoulder, and you expect the patient to come at least for 10 sessions. Okay, so explain that no, anyways you will have to come for 10 sessions, then why not you pay as per the package. Now why I have designed, this, I have learned my own lessons over these 4 years. Initially I had no packages, I used to charge no per session. There were a lot of people who would tell me that no, give us some discount, some concession, we have to come for 15 days, we have to come for 10 days at least. Okay, so I thought, okay fine, I will give you some discount. So I give some no 25 rupees for 50 rupees, 100 rupees discount. And what do the patients do with me? They come for 5 days and then they don't come. I gave the discount thinking that the patient is going to come for 10 sessions, but patient did not turn up after 5 sessions. So see, we are, no, after all, this is a business. you are doing your good work, agreed, but you need to be given enough respect, due respect financially for what work you're doing. Then I realized that I should design the packages, because probably I was new, I had no idea. So then I designed packages and I told them that if you want to have some discount and go for packages, you need to probably pay in advance. So pay for 10 sessions in advance and then you can have some discount. Pay for 15 sessions in advance and then I will give you discount. So what happened with this? I made sure that patient is paying for the sessions despite of the discount and probably coming regularly. And it is sessions, it is not days. So every session is counted. So Sundays, Saturdays, the days they don't come are not counted. So it is fair enough on both our parts, on the patient part and my part as well. Okay, a lot of patients I have some in between my QR code was not functioning properly. So I had a lot of issues with that, because now people don't have in hand cash, especially the work from home IT sector. So then that was a very big issue for me. No, I had to really keep a follow up of that guy who was making the QR code for me, because I am not very intellectually good about all these things, QR code and all. So this is necessary. What I want to say is this is necessary. Have all these things which are trending right now in your clinical setup. Documentation, of course, we all have been taught about documentation right from first year of our physiotherapy. We are doing it as physios in our hospitals, in our colleges, everything. But the major role of documentation is when you have your own practice, because now you are answerable for everything that happens to the patient, right from the registering that name of the patient, to the payment, to the refund policies, everything. Okay, so basic documentation also has to be there, and assessment findings and management plan and treatment given has to be documented very well. This is necessary for sometimes the insurance reimbursement and referring back the patient, or giving the a follow up to the referring doctor. When you're giving follow up to the referring doctor, sometimes you need to send it in writing with your patient to the referring doctor, that this is what has been given, this is the prognosis, this is this is the plan of action. You need to explain that this is what I have achieved, but I still need to work on you for another say 1 month, since it's say probably it's pediatrics, so I still need to work on that patient. This is my plan of action. Okay, that has to be documented. What you want has to be documented very well. Sometimes a patient will come after 1 year to you and say that, ma'am, that time I had taken treatment for sciatica, I was absolutely fine after that, but now after 1 year my pain is recurring. What should I do? Now if my patient flow is too much, I don't have that much of ability to recollect that what treatment I had given that time. So if it is written, documented properly and kept with me, I can see to that. I can see that what were the MRI findings 1 year back? What are the findings right now? Is it same? Is it deteriorated? What treatment changes I need to do? Everything has to be documented. Okay, because as I said, when it comes to private practice, you are answerable for each and everything that happens with your clients. Now, the major component is how to increase the revenue. Yes, patient is coming, I have started the clinic, everything is there. But revenue should be enough. No, what revenue I generate from my physiotherapy practice should be enough that cutting off the expenses, I am still left with some profit, isn't it? After all, it's a business. So the department or center should generate enough revenue such that substantial profit is left after cutting the expenses. So what all expenses can be there? So rent or EMI, the basic expense, the maintenance, whatever. So electricity bill, whatever chotu motu, no, your electrotherapy modalities, they break up, or your equipments has to be purchased, new equipments for exercise therapy has to be purchased. Anything, small things, like as I told you, my website was not working, probably in between there was problem with QR code, so I have to communicate with those guys, pay the fees, the CCTV facilities that I have in my clinic, again that is essential, that gave away once, because it is after all maintenance, everything has to be maintained. So you need expenses for that. Staff salary. If you're having a receptionist, you need to give the salary to that receptionist. The maid who comes to clean the clinic, the salary has to be given to that. If any other physiotherapist who's working under you, in your absence, you have to give the staff salary. So that has to be considered. And miscellaneous, any XYZ amount, miscellaneous amount that has to be paid. So everything, like miscellaneous, say probably in between we had problems with the water supply in the entire society, in the building. So now there were miscellaneous expenses that I had to bear because I had to get the water from outside. Okay, why do I need water? In general, for no drinking purpose, patient drinking purpose, for washroom, everything. But yes, I had to spend some xyz amount to maintain that. So miscellaneous expenses are also there, so consider those as well. Now, here are certain tips to increase the departmental revenue. These are what I have learned over over the period of 4 years of my own clinical practice. So, try to keep the department functional for longer hours. So, how do I keep it functional for longer hours? So, see, if it is a rental space, it is advisable that you you keep the space open and functioning as much possible as much as possible. So maybe I have seen clinics which are functional from morning 8 to evening 8 as well, or which are functional only in evening 3 hours. So see how much time you can dedicate. If you cannot, then give that space to some other therapist, maybe in the morning time. In the evening time, you do it. In the morning time, another therapist sits. The purpose is utilize the space as much as possible throughout the day. More the patients, more the revenue. Utilize the available space maximally. So you can call multiple patients simultaneously, of course, maintaining the privacy. Follow evidence based practice. This is essential because now you have one group of patients coming to you who is highly educated. So before they come to you, they have googled everything about what is the probable diagnosis, what is the type of exercise therapy that can be given, what are the electrotherapy modalities that can be given, everything. So then you have to be up to date with your own knowledge. So have evidence based practice, update your knowledge about different topics. Okay, so keep updating, keep reading the published literature, about the topics that you're interested in, about the flow of patients that you see, what type of patients do you commonly see. Keep reading about the treatment management, about the different surgeries that are done for them, what are the advances in those field. Make maximal use of social media, have been speaking about the same. Get genuine review about your work and department on social media. I'm again stressing on this. Genuine is very important because once you get into this field of having your own practice, eventually you would come to know that there are a lot of politics, or what I should not say politics, a lot of miss wrong things that are also done. So genuine reviews is very important. And organize medical camps, educational camps, awareness seminars. So keep promoting the work that you do. Start with different classes, as I told you, maybe ANC, PNC classes, fitness classes. Enroll yourself into different certificate short courses to enhance your skills. So it has been quite some time now, the therapist has passed out. So over the period, there is something that we keep lagging. So no, and keep doing some certificate course, keep enhancing. So as I told you, if you want, you can start doing dry needling in your setup. You can get yourself, now it's with this pediatric, get yourself NDT certified, do Mulligan course, or do cupping, or do PSRP, anything. Basically, just keep yourself updated and keep enhancing your skills. Appear into public promoting your work and your department. So maybe attend conferences, publish papers of the research that are conducted at your center. Then even if it is a small, even if it is a case study, yes, if you're good at that, you can publish that. You can, if not publish, at least speak about that. No, into conferences, just go into public and start speaking about the work that you do. Write blogs related to your areas of interest, put that on your websites. You can put the put the links on your Instagram pages, and get more views, more people to read about it. Okay. Managing your private physiotherapy practice, this is the last part of the the seminar that I have today. So we have planned, we have started executing it, but managing it over the long term is what is important. And it will be managed only on the basis of the trust that you develop no with your patients. There has to be trust rapport that has to be developed with your clients, with your patients. That we have to make sure that the patient who comes to you for consultation comes back again to you for therapy sessions as well, completes the therapy sessions, that those are recommended. Unless they complete the therapy sessions, they probably are not going to have 100% benefits from physiotherapy. Now if they don't get 100% benefits from physiotherapy, they are going to go outside and probably speak that I took physiotherapy, but kuch aaram nahi mila. Now you cannot go and say that kuch aaram nahi mila because you did not complete your course. You did not do the exercises properly. You did not do the exercise at home. So it is important that you educate your patients, and have a good rapport with them, so that they keep coming to you and follow what instructions you are giving. Then only they will receive the benefits of physiotherapy. So how to build the trust with your patients? Be truthful towards your patients. So whatever is the condition, say neurological, pediatrics, orthopedics, whatever is the condition, explain genuinely, truly to the patient about it. Like if it is pediatrics, a lot of parents, they ask me, when will the child start walking? I have to tell them truly. Okay, the child is 1 year right now. The child will probably start walking by the time the child is 3 years old, by the time the child is 2.5 years old. Itna time lagega? Yes, because there are a lot of aspects. Then you explain the patient what are the lot of aspects that you are working on. The child right now just sits, and you are expecting the child to stand and walk. It is going to take time. It in neurology, the progress you get is very slow as against orthopedics. So if it is orthopedics, you get a lady with no knee pain. You're giving physiotherapy, 10 sessions ho gaya, then no pain was fine, and then after 15 days, patient again comes to you that it is still painful. Tell the patient, explain the patient that your orthopedician has suggested you to go for replacement surgery. It is grade 4 orthopedic, get grade 4 osteoarthritis. You need to get a replacement done. Otherwise, exercise will give you temporary relief. Be truthful to your patients. Assess every patient's problem sincerely. Listen to their problem sincerely. Okay, their problems are going to tell you the functional disabilities that they are suffering from, and is going to help you design the functional treatment, the functional ways of treating them. Don't think about how can I earn maximally out of this patient. That is a completely wrong approach. Think about how I can help maximally this patient. Okay, report back about your assessment, treatment plan, and prognosis of a patient to the referring doctor. Whoso has referred, give the follow up, because that is important. That gives that again creates an imprint about your work and about your name, about your clinic's name, to the referring doctor, who would probably again keep referring the patients to you. If you don't give the follow up, the referring doctor doesn't know what happened with the patient, why the patient has not improved, why or how the patient improved. So keep giving the follow up. Okay, now coming to the last part, these are certain frequently asked questions to me by the patient. So just to give a brief idea that how do we tackle these. So how long do I need to come for therapy? Yes, this is commonly asked. So depending upon the condition, we always explain that you will have to come for 5 sessions, you will have to come for 9-10 days, you will have to come for a month. Okay, tell genuinely, explain them. Like for in pediatrics, I tell them that the condition right now is, I would give the child will improve tremendously if you come regularly for at least a month. Then after that, we can cut down to the alternate sessions or twice a week sessions once we get basic improvement. Okay, can I get some discount? This is definitely going to be asked to you by your patient, despite of how much ever educated the patient is or how much ever poor the patient is. So as I told you, be ready for the answer for this. Can I get some discount? So how are you going to answer this? You cannot keep giving discounts to every patient. Then how will you earn? So manage your fee structure accordingly. My referring doctor has advised only electrotherapy. Then should I do the exercises as well? Yes. So this question is commonly asked to me, that doctor has advised only electrotherapy. They have not told me to do the exercises. Then, but as a therapist with recent advances, evidence-based practice I'm doing, I know that exercise therapy is something is going to give long-term benefits to the patient. Electrotherapy is probably just temporary. Then it is my duty to explain to the patient and probably to report back to the referring doctor as well that exercise therapy is necessary, and I would advise for that. Okay, have you treated clients with conditions similar to mine? Yes, I do get this question a lot of times. Okay, especially when I get calls for home visits. I have a home physiotherapy services as well. So when I get calls for this simple cases like no total knee replacements, I get a call and they ask that, have your therapist treated such cases previously? Okay, so the group of the setup which I have, the therapists whom I have, of course they all have treated, but it will be asked to you. So you need to be calm and you need to explain them that yes, we have experienced therapists, we know our work. Okay, how many years of experience do you have? A lot of patients bindas मुंह पे पूछेंगे तुम्हें, do you have experience? So again, be calm, be, no, don't get offended and say that yes, I have treated such patients, I have this much of experience. How long will each session last? Of course. So again, be truthful to the patient that at least half an hour, 30 minutes will be required. So no, make sure that you have that much time, because if the patient is hurrying up and is not interested in doing the exercises properly, then again it is going to hamper the benefits or the, prognosis. Will I be treated by same therapist every day? So now if it is a big setup where no multiple therapists are there, or if a setup where morning different therapist is there, evening different therapist is there, sometimes the patient comes in the evening, sometimes the patient comes in the morning, as per the patient's convenience. So be truthful again and tell that yes, in the morning this XYZ therapist will be there, in the evening this person will be there. So there might be change, but yes, we have it documented in our sheets properly, so the treatment will be same irrespective of change of therapist. Will the treatment be painful? So again, a lot of patients will ask you this as well, will the treatment be painful, will the exercises aggravate my pain? So sometimes you have to be against, not say that yes, if you don't do the exercises properly, or if they are done in a wrong way at home or something, the pain might aggravate. So be ready for that, just give me a follow up, you can call me if the pain aggravates, I have solutions for that as well. Okay, so these are certain questions which I thought, which are commonly asked to me in my department, in my practice. Apart from these, there might be multiple questions which other therapists will face. This is just to give you an overview. Okay, so yes, that's from my side. If you guys have any questions for me, you all can go ahead. And thank you for giving me this opportunity.
Thank you so much, Dr. Preeti, for such an informative talk. So one of the viewers want to know that when you began your, during your first 6 months of
Yeah.
starting the clinic, any shortcomings or personal struggles you would want to share about? But we understand that that probably could be just from neuro perspective. So would you like to share anything personally, any shortcomings which you would like to, as a tip, you would like to tell the audience
Okay,
how they
yes.
can overcome?
So, see, now when I started my clinic, this is again my personal. When I started my clinic, my elder one was just 9 months old. Okay, so my personal thing was I had a small baby to take care, but I was working 3 hours in the morning and 3 or more hours in the evening. So I had some settings at the home to take care of my kid, which sometimes no, my baby would fall sick, my maid won't turn up. So there were a lot of those issues that I had faced, and I had to then professionally, it did hamper sometimes that no, I had to cancel the appointments. I probably reached late. But thankfully, as I said, building a rapport with your patients is very necessary. So, I have a very good touchwood, a very good receptionist who would manage. She would explain to the patient that ma'am is running late because of this XYZ reason. So, but till then we will take care of it. So, probably my receptionist and my assistant therapist was there who would start the therapy, or just start with maybe ice pack or something just to begin with. Or we would always give a call to the patient saying that ma'am won't be able to make it today, so we are canceling the appointment and we are rescheduling it for tomorrow. This is again very essential to have a good communication from your end with the patient, because that keeps the trust factor built up properly. Otherwise, once the trust factor is broken, that will be a problem. Another thing, as I told you, a lot of patients in the initial 6 months asked for discount, didn't pay, turn up saying that मैं कल pay करती हूँ, then turn up saying that is it okay if I pay for 2 sessions together? And when you are at this side, you have to say yes. You cannot not say no. You cannot say no. You have to pay right now. Okay. Because no, you have to think long term, there has to be a vision. I cannot be so blunt that if you don't pay, then you cannot come tomorrow, or if you don't reach on time for the appointment, consider your appointment to be cancelled. This cannot be done. I have never done this. My patients have come even 10-15 minutes late, half an hour late, we have still somehow managed. Okay, so here is the trust building factor. If they have not paid, we have tried to give a follow-up calls to them through my receptionist, saying after 1 week or so, saying that ma'am, your payment is pending. Few of them have turned up and paid, few of them have never turned up and probably not paid. But that's okay, that's a part of learning experience. I learned, and then that's what I said, then I made the package system, and I made sure that no, if you want to come, I want to have discount, you pay in advance within the first 2 sessions, then only you would be given the discount. Okay. Apart from that, yes, I had situations where initially I was the only therapist working. Probably sometimes because of my baby, I would run late. There would be 2 3 patients, sometimes more patients waiting at the same time. So thoda sa na, it used to create a little bit of chaos in initially, that whom do I start with first. There would be a little bit of argument with my receptionist, that no, why do you call so many patients at the same time, no, why does this happen, then please see me first. Okay. Then sometimes I had to keep a pediatric child waiting and see orthopedic cases. Though then that created an issue that no, baby slept off, the baby was hungry, children started crying. Then the parents got little off that no, you should try to follow the time and everything. So thoda about on and off, some practical issues everybody will face, but the whole point is how do we manage it. No, that's what. No, keep calm, don't get offended with whatever, because we are here as professionals. One wrong word that you're going to put, and that is going to spread in the community. That nobody's going to remember that ma'am was so kind, that she considered that I paid fees after 5 days. But one wrong word that I say, probably that is going to be like, ma'am ne aise bola tha, ma'am did this. So this is what, we have to be very very careful about what we speak with the patient, what are we going to tell the patient. Okay. Anything else?
Right, right. Very correct. And one more viewer wants to know that how important is language when you have to, when you go for a full-fledged clinical practice? How important is knowing the local language? Like, can you still go on with Hindi or English, or is it very, very necessary to kind of have a good hands-on with the local language?
Okay. See, now, considering our Indian culture and variability of language, yes, it is essential that we are well versed with the local language. Now, I am working in Pune. I know Marathi, Hindi, English. My community, the area where I work, I get a lot of Marwadi, Gujarati patients. I know that as well. So I personally did not have a lot of issues. But yes, another therapist who works with me, she is not very good with Hindi. She is from a pure Marathi background, but she picks up Hindi properly. She understands it. Communicating in a proper Hindi way gets little difficult. My receptionist is also poor in English and Hindi, but we are managing, you know uh, because we have a team. So if my assistant is not able to speak, I help her if she is not. Okay. I am not very good in writing the exercises in Marathi, and a lot of people, they expect me to give the exercises written in Marathi. So what I have done is, I draw the stick diagrams, my receptionists write it, I dictate, she writes it in Marathi. I am not good in writing Marathi. I can speak that. So local language is necessary, of course, but ultimately what is necessary is, you if you have a team built up where you can know someone can fill for your flaws, or someone can fill for your incapacities, then that is best. And despite of that, if it is a completely different community where local language is absolutely not understood, but still with the communication, like the way I am from Manipal University, there Kannada was essential, and I know how what I have struggled, or how we have struggled, especially with Malayalam and all. So no body, learning few basic words and explaining with your sign language can also be good enough. But of course, eventually, it is my advice that if someone is working in a different language setup, linguistic setup, try to learn basic words at least.
Right. So
Yeah.
yes. So thank you so much. You also gave the example of having a good team. That so then if something is somebody's weakness, so you can always
Yes.
overcome. So it's not just
Yes.
you you also have to have a nice and supportive team to run a successful clinical practice.
Definitely a team. See, now when I started, it was one child I had to take care for. Now I have two children to take care of. Okay, now my young one is 1 year, my elder one is 4 year. So I am working. I'm able to be here today right now again is because of the team that I have. My assistant therapist, the junior that I'm working with me, my receptionist. So teamwork is essential, and no, building a team is also very very important. Like no, the people who are there with you from the beginning and making sure that they continue working with you. Okay, so थोड़े ups and downs उसमें भी आते हैं. You will have to no manage. बाबा, no, they want to go for a leave. No, some XYZ thing happens. But still, despite of that, as a responsible person, as a head person, you have to manage a lot of things, look after a lot of things, but make sure that you're good to everybody. And the team is never broken. Is important. Yeah.
Right. Completely agree with you.
Yes.
So thank you so much, Dr. Preeti Shah, for your valuable time and the entire enlightening session. And I'm sure all these budding therapists will take up your tips and will definitely do a successful clinical practice in the future. And I also request you on behalf of entire college and the ASCOP committee to please be associated with us for our future talks and rather offline sessions with our students. So definitely, once this COVID scenario subsides, we'll have an offline session with you for our students.
Yes, definitely. And I'm very thankful to Suroshri, you and the entire Sancheti staff for giving me this opportunity and getting associated with Sancheti again as an alumni. And I'm looking forward to many more such seminars, hopefully offline. Whenever
Definitely.
you just have to send a WhatsApp, and I will be there. If you want a pediatric topic or anything, I'm always there.
Definitely, Dr. Preeti, definitely. Thank you so much, and we wish you have a good day and a successful clinical practice ahead.
Thank you so much.
Thank you
Yes.
so much.
Yeah.
Bye.
Bye-bye. काढला ना 2-3 व्हिडिओ काढले.